New at 4:30, a blood test at birth could potentially identify babies at risk of SIDS. Sudden infant death syndrome is the leading cause of death in the U.S. among babies up to a year old. A new study from the University of California, San Francisco found newborns with a particular group of chemicals called metabolites in their blood were more likely to die from SIDS. Doctors say the study is a huge step toward testing metabolic markers along with other risk factors to try to prevent SIDS. So that's a big development. Yeah. And a suburban high school student is speaking out about his experience with bullying. He suffers from chronic skin conditions that impact his appearance.
Now, some research done right here in Chicago found bullies target children with skin diseases more often than we realize. Here's health and wellness reporter Lauren Petty.
It's something David Arts manages every day.
My skin condition is called IFAB, and basically my body doesn't really know when to stop building skin.
It causes scaly patches on his skin, while another disease called alopecia has left the 16-year-old without hair and eyebrows.
I wear this hat every day.
David says it's a form of protection after he's dealt with intense bullying.
It happened throughout the whole 4th grade, and it was truly traumatizing for me.
David's dermatologist, Dr. Amy Paller, says David is not alone.
I think skin diseases are very much underrated in terms of thinking about what can happen with the whole child.
Dr. Paller authored this research that found 73% of children with chronic skin conditions experienced measurable stigma.
This stigma was very much associated with mental health, depression, and anxiety.
Skin conditions can include alopecia, vitiligo, psoriasis, eczema, which affects more than 10% of school-age children, and even acne, which impacts more than 90% of teenagers. That's why Dr. Paller is calling on clinicians to not just treat the condition, but ask kids about the impact it's having on their life.
Perhaps because they don't think it's so severe, that it can still have a serious impact on the mental health and the well-being and the self-esteem of that individual.
Dr. Paller says educating other children is also key, something David is trying to do.
People don't know, and they won't know unless you tell them. But when you tell them, it's also you're being vulnerable.
He took the leap, starting a website and social media pages to share his story and inspirational quotes to help others beat whatever stigma they face.
It's okay to be different.
Lauren Petty, NBC 5 News.